We'll be starting in a few minutes, just giving people plenty of time to log in before 12:30. Those of you who are already logged into the Zoom webinar platform, you can start introducing yourself to each other on chat if you like, say where you're from, just get your names out there. Will be a few more moments before the live YouTube live stream is up, and then we'll start at 12:30, I think, exactly. Thank you. Okay, just while we're getting set up, coming up to 12:30, let me tell you a few things that are applicable to the people who are on the Zoom webinar platform. By the way, those of you who are watching on YouTube, that we have several hundred more available spots over here on Zoom. Feel free to click on the Zoom link that's below and log in. It's pretty seamless, and we'd love to have you on live with us where you can ask questions if you like or chat with others in the background. For those of you that are on Zoom, you will notice that across your menu, there is something called Q&A. Q&A is where you will write questions to ask Elinor at the end of the segment. Please be advised that we will ask you to go live to ask your questions. So you want to have your camera and your mic ready for that. And then also, if you have technical problems, please put them in the Q&A. The chat is for you to talk among yourselves. So there's 20-ish of us logged in right now. You can chat among yourselves, and as we go along, introduce yourself, ask each other questions, make comments. There's been some nice, robust discussions I can see from looking at them later in the chat, so please feel free to use that. Our assistant Arlene, who's in the background, will also type in some helpful hints or things that you might need to know in terms of links, etc. there. We will be having a movement section in this place. You only will need a chair and yourself and your camera. And when it comes time for the movement section, we'll ask you to raise your hand and we'll select it so that you can be seen. This is the Zoom webinar platform, which means that when you're in gallery view, or really you only ever just see the speakers unless we specifically bring up an individual participant to be seen. So you will not be able to see each other by switching around into the views. And it looks like, from my perspective, based on comments, I'm completely in charge of what view you do see. So I'll try to do my best on that. Hi, I'm Cynthia Allen. Welcome to the Feldenkrais Awareness Summit. Just to recap, for those of you who are on live Zoom platform, you can ask questions that we will make you live to ask in person again later to Elinor, but we appreciate you sending in your questions ahead of time in the Q&A section. You can also type any technical questions you have there. Please chat among yourselves in chat. And those of you who are still on YouTube Live, a couple hundred people have been watching YouTube Live, please go ahead and come on over and join us. There's plenty of room over here in the live platform. It's really not too hard to navigate. I think you might enjoy it. And you can do that at any time. Okay, I'm going to get ready here to introduce our speaker. And okay, Elinor, yes, there we go. Beautiful.
Good morning. Good day.
Good morning. This is Elinor Silverstein. I'm Cynthia Allen from the Feldenkrais Awareness Summit, and this is Elinor Silverstein. Elinor is an internationally recognized Feldenkrais practitioner holding degrees in biology and zoology. She has 35 years of experience as a Feldenkrais practitioner, and she has a little genealogical connection as well, a little lineage connection, blood connection she might say something about. She's worked with children and adults with very challenging nervous disorders and has found that she needs to include the gut in her understanding of how to help people more. She has a private practice in Orange County, California. She loves her dogs, her animals. And she also teaches some really wonderful online programs, or at least some online things are coming up for sure. So I think you've done some in the past as well, because I've done some with you. So we'll hear more about that later, but welcome, Elinor.
Thank you. Thank you so much, Cynthia, for creating this possibility so that so many of us could teach and communicate with each other all over the world. I love being able to attend and to participate in online programs like this, because it just shows how close we really are, right?
Mm-hmm. It is. So I think you're going to dive right in.
I will. Let's see. Hold on. Boop, boop-be-doo. All right. Can you see it?
Not yet.
Okay, let me go back. And it just, I wonder why.
Oh, it just wanted to give you an extra challenge. We know what that's like right now. The technology loves to give extra challenges just when you least expect it. We did 26 dry runs. They all went well. The first live, not so well.
So this is still not showing, huh?
Still not showing. Mm-mm.
Oh, that is okay. I'm not doing anything any different. Yes, I am. 1 second. I know. Here we go. Oh my goodness. I do this all the time. There we go. Now you see it, right?
Yes.
Okay.
Thank you.
I'm sorry. Okay, so welcome to this class that is on acid reflux and vagal tone and how we can help ourselves and others. And what the heck do the two even have to do with each other, right? So let's go into this. And by the way, Cynthia mentioned that there was a little bit of communication regarding Moshe with me. And I would love to just give a little piece, because you brought that up, is that when I lived in Israel in the last year and a half of my training, I spent a lot of time with Gabi. And Gabi loved working deep, deep, deep into the organs. And I asked her why. And she said, because, you know, in Feldenkrais and in all of these beautiful bodies of work, we work with movement to the whole body, but if a person comes back and they're still crooked, how do we know that it wasn't what was going on with the organs that was keeping them pulled? So she liked to go in really, really, really deep. And I was like, that's an interesting concept, but the deep stuff is not for me. I wouldn't want to cause any possibility of injury and anything like that. So between having those conversations with Gabi and then having those conversations with Moshe, it kind of opened up my thinking. So hence, now we come into something which is really, really prevalent, and that's acid reflux. So I'm fast forwarding to nowadays. Let's see. Okay, so for a moment, just take a moment as you're sitting there to just take this moment and breathe and notice how you're sitting. And that's the wonderful thing that you're getting in so many of these lessons is the Feldenkrais teacher is saying to you, just sitting there with your feet on the floor, just sense yourself. And welcome to the Feldenkrais method, way of thinking and helping yourself and others. So, what is acid reflux and how do you experience it? Did you know that approximately 20% of the world's population has acid reflux, otherwise known as GERD, which is gastric esophageal reflux? That's between 42 and 64 million people. And I believe that's not even the silent acid reflux. So that number is the people who are diagnosed with acid reflux, but there's even more that suffer from silent acid reflux. It's kind of like when you're in Alaska and you see the iceberg, but you see the tip of the iceberg. I think the silent acid reflux is how big it is under the water that doesn't even show, except that it shows in many ways. And we're going to discuss that. Also, did you know that many, many babies suffer from acid reflux? And there's a lot of reasons why. And the real tough thing is that they're giving proton pump inhibitors to these babies from birth. And we won't discuss that so much today, but in the course, we go into great detail about that. Also, yes, even dogs can suffer from acid reflux. So acid reflux, let's see if I can bring let's see. Okay, well, anyway, I'll just come back. Do you see the lower esophageal sphincter and the upper one? There's one down at the bottom by the stomach and there's one up on top. So let me see if I can no, it doesn't go through. Okay, so the lower one at the very bottom
Elinor, there should be some little pointers that you can use up there in your options. If you want to use a pointer to point at things, you can.
In my options.
In your options with where your screen share is. There's usually annotation, pointers, things like that. You might see them real quickly if they're important to you.
I see current slides. Nah, that's okay.
Okay.
That's okay because I don't want to fiddle with it. But it's interesting when I played with it before, it went on there, but it's not going on now. But if you can see the stomach down at the bottom and of the slide is a sphincter that connects the esophagus and the stomach, and that's called the lower esophageal sphincter. And then up near the throat, there's the upper esophageal sphincter. So the lower esophageal sphincter or the lower sphincter is the sphincter that is designed to let food in and stay closed so that all that hydrochloric acid in the stomach can break down the food and turn it into all the amazing nutrients that help us to function as living beings. The lining of the stomach is designed to withstand and love and adore those high levels of hydrochloric acid. The esophagus is completely different, soft, mucilaginous tissue. It's soft. It is not designed or meant to have acid in there. So if that lower sphincter stays open or leaks a little bit, It can be very open or a little bit open. Some of the acid can come up and cause heartburn. If the upper one is open, the upper esophageal sphincter, it can actually allow acid to creep up into the voice box and up into the sinuses. And that is where a lot of the silent acid reflux lies. We're going to go into more detail about that. Is your body burning to tell you something? So here are some of those silent, which are not so silent, reactions to reflux. Excessive throat clearing. Have you ever talked to people where they're always clearing their throat and they just always feel like they've got mucusy in there, always clearing their throat? Or people who have a persistent cough. Have you ever been to the theater or a lecture someplace and the room gets quiet and all of a sudden one person in the room, there's a couple hundred people in the room, and one person coughs and then another person coughs and another person coughs, and then you can tell almost the age of the room, that it's 50 and older, I'm not joking, by how much coughing goes on throughout the room. It's that kind of persistent cough. And there's always one person that tends to be more of the cougher. It's a tough situation. They're not sick, but there's that irritation that comes from the acid. Also, some people have a tendency towards hoarseness, raspy voice. Some people make a good living being a singer or an actor with that hoarse and raspy voice. But that's the silent acid. So I'm not saying take it away, but I'm saying it's a problem because the acid is irritating the voice box. How about this one? Trouble swallowing. You ever noticed as you get older, you tend to swallow your food down the wrong tube a little more often than you used to? So that is one of the situations. And in the course, we go into more detail how to actually correct that mechanism. There's another one called trouble breathing. Some people think it's asthma and they think it's allergy asthma, or the doctor will say it's not allergy asthma, but they don't understand what it is. If there's silent reflux coming, what happens is as a person lies down, the acid can come up and spill back down the trachea and dribble into the lungs, causing irritation in the lungs. There is no place for that beautiful soft air tissue in the lungs to have acid in there. So the body's going to always try to cough it out, but they're also going to end up with irritation, which is called asthma. That's a version of it. And then some people have a chronic sore throat. That's the acid in there. It's interesting. I find it fascinating because these are so many things that are undiagnosable. But if a person has a few of these, you start to realize there could be silent acid reflux in this. Here are just a few more symptoms. A frequent feeling of postnasal drip. Do you notice any of you kind of always walk around with your tissue, always postnasal drip, or postnasal drip, right? The going down the back of the throat, and it causes you to choke and to wake up in the middle of the night choking, or maybe your partner. Also, again, I can't bring it up enough. Trouble swallowing, the swallowing down the wrong tube. Acid reflux, when it's silent, can also trigger off sleep apnea. So some people who have sleep apnea, but they can't find out why they have sleep apnea, this can be involved in that. Also, chronic bad breath, because if you've ever smelled the breath of someone who's really suffering a lot of acid reflux, there's a sourness, and they'll tell you they have a sour feeling in their mouth too. It's not their fault, it's acid reflux. And then in the course, we go into more of some of the things that we can do. Today, we're going to use Feldenkrais awareness through movement lessons and variations of that. Also, the last one is belching. How many people do you know who just walk into a room and go, bah! And wherever they go, they bend over, it's a belch. That's a lot of air going on in there because of irritation. So I want to say that with we can use Feldenkrais breathing lessons to get the two tubes when we're talking about the swallowing down the wrong tube. We can use Feldenkrais awareness through movement lessons to get these two tubes and sphincters, the lower sphincter and the upper sphincter, to work more harmoniously with each other and together again. In Feldenkrais, we have lessons that are called coordinating the flexors and extensors. We can also coordinate the sphincters. That's a wonderful situation to do, the fun, wonderful idea. Okie doke. Did you know there's some pretty famous people that have acid reflux, right? So I think you recognize 3 of our presidents. Some of our other presidents have had other issues, but here are 3. And notice all 3 are eating ice cream. Of course, Bill Clinton is saying, I'm not eating ice cream. He's eating ice cream. But you know, when you have acid reflux, ice cream feels better because it's cool and it's creamy. It doesn't make it better, but for a moment it feels better because the dairy can cause problems. So I want to talk to you a little bit about what happens when, because we can look at this slide also, aside that it's cute and that it's funny, but we can also look at it as in eating. And if we look at people who tend to overeat and related even to overweight and obesity, did you ever wonder if that, or if you notice yourself in between meals, do you feel hungry in your stomach or do you feel hungry here in your esophagus, like a tightness? If you ever feel hungry in your throat or chest area, that can be a little bit of the acid from the bottom of the stomach leaking up the lower sphincter and just tickling the esophagus just a little bit. And so what happens is we think we're hungry because we're getting a spasmy kind of feeling going on in the esophagus. We're thinking we're hungry. So what do? We go to the kitchen and we eat some carbohydrates or we eat something that's a little fatty, but mostly we'll go for like chips and crackers and stuff. And it's not because our blood sugar was low, but it was because we had that tickle here. And as soon as we put food in the stomach, did you notice that the tickle in here in your throat goes away? If that's the case, that can actually be a little bit of acid reflux. So that's something to think about. And there's things that we can do that we can test on ourselves that we learn about with just having a warm cup of tea. If a warm cup of tea makes it feel better, and you'll learn some of the self-awareness through or functional integration lessons we can do on ourselves, if that helps it, then that means it was a little bit of acid coming up and you really weren't hungry. That's a nice thing to know. So here's the thing. How often is it real hunger and how often is it acid reflux or a little bit? Okay, here are some possible causes. Sometimes it's mechanical. It can be a hiatal hernia. So you can see where the stomach meets the diaphragm. You can see where the stomach meets the diaphragm. It can be bulbed up a little bit. And so that means that the sphincter, again, doesn't stay closed. Some medications can cause acid reflux. And if you think that you're on any medications that cause acid reflux, talk with your doctor about it. But the reason why I bring this up is, bless my mother. She's going to be 91 years old next week. And my mother has high blood pressure. It's called idiopathic high blood pressure, but I pretty clearly have an idea of what it's from. But the blood pressure medication saves her life. But the side effect of that blood pressure medication, because she needs the strongest stuff that's out there, is really common. It relaxes smooth muscle fibers. And the sphincters from the stomach up to the esophagus and the upper sphincter are smooth muscle fibers. So it's not just going to relax smooth muscle fibers of the blood vessels, but it relaxes all the smooth muscle fibers. So the side effect is she has acid reflux. But the good thing is we're able to keep her on the medications that are life-saving, and we use these Feldenkrais kind of movement and hands-on ways of working or techniques that we can do on ourselves to help with it, and food choices. Okay, also, It always comes back to stress. So with stress, we have increased cortisol, which decreases healthy digestion. And if our digestion isn't working so well, it's going to affect our immune system and allow for overgrowth in the belly to happen. And if overgrowth of bacteria in the belly happens, that pressure can cause the sphincter to open that way too. So this is where I would teach an awareness through movement lesson, but we've got a few of them at the end, and we'll do the movement lessons after. So if you will forgive me for only doing this part in the beginning, we'll go to the awareness through movement lessons after. But here's an example. What can we do to help ourselves? Well, we can talk about the Feldenkrais awareness through movement and food, but we can also talk about the vagal nerve. So if you look here, and this is what I promised you to talk about today, the vagal nerve starts in the base of the brain and it travels down along your carotid arteries and your throat, and it innervates deeply into your heart and around your esophagus and trachea and all over your stomach muscle and into the stomach, and then all the way down to all the digestive organs. But it also is part of what's going on in the face structure. So when you have that feeling of soft eyes, looking into somebody else's eyes, if it's safe, that helps to tone our vagal nerve. And if we tone our vagal nerve through softness in our face and in our eyes, with sincerity and the tone of our voice that we have when we're happy, then the vagal nerve can function better, and therefore where it branches to the stomach will function better also. Does that make sense? So it's like we don't have to just work the vagal nerve from the gut, but we can also work the vagal nerve from our expressions on our face. One of the other things that vagal tone is known for, according to Dr. Stephen Porges in the polyvagal theory, is prosodic voice. It's singing and cooing. So for instance, if I were talking to my dog and I go, I love you so much. I had a baby, my grandson in my arms. I love you, I love you, I love you. That's prosodic voice. Or singing, I love you so much. I love you so much. Singing, that is prosodic voice in its harmony. And that helps give us happiness, because that is toning the vagal nerve. One sec. So here we talk about prosodic voice and expression, especially up in the eyes. So you know how we say, I can trust that person because I can trust the look in their face, specifically their eyes. So you've heard people say he has shifty eyes. He has trusting eyes. I could make eye contact with him. These things are important. And again, really low vagal tone usually means the voice talks like this. There are some people that talk like this, and that affects the vagal nerve also. And again, Dr. Stephen Porges talks about this in detail in his book, The Polyvagal Theory. So here's just a little bit of anatomy. I'm looking at the clock. Here's just a little bit of anatomy on the vagal nerve. And again, I wish that I could get my pointer, but you can see on the left is the spinal cord, and on the top coming out is the one vagal nerve branch. It's the vagal nerve branch, and it goes everywhere. If you can see, it goes into the face area also, but it also goes to the esophagus. Do you see all the way to the right? That's the esophagus. And it goes to the trachea, and it goes to our aortic branch. Hello, aortic aneurysm. Hello, calcification in the arteries of the aorta of the heart. So this is another reason why I think Feldenkrais awareness through movement is so important, and de-stressing and movement and understanding sense of self, because when we do that, we actually tone our vagal nerve. We tone our vagal nerve all these essential organs that the vagal nerve goes to can send better information. You can also see it goes to the lungs. It's so rich into the lungs, and it goes to the liver and the gallbladder and the stomach for sure, and intestines. So I will show you. Here we go. Not so pretty, but I think this is beautiful. To me, this is absolute art. So if they were to see just the vagal nerve branches, if I went that way, let's see. There I did. My thing went through this time. Okay, so here's the brain. Now look at the vagal nerve branch. So you can see here it's going around. It goes up towards the face. The vagal nerve is also next to a nerve called the trigeminal nerve, which is one of my favorite nerves, along with the vagal nerve. Because they're next to each other in the base of the brain, when you stimulate the vagus nerve, you're going to stimulate the trigeminal nerve, which goes to the face. And that's for another time. But you're going to see what the vagal nerve has to do with acid reflux. So here we can see where it's going down. And I'm sorry you see me reaching over, but you can see where it's going down rich into the stomach area. And so and then it goes all the way down into the intestines, all the way down into the floor of your belly. So when we work with the vagus nerve, we can help work with the motility of the stomach. When we work with the motility of the stomach and assuaging those symptoms in the throat and in the neck and in the chest, we can help acid reflux that way. Now, also, here's a way that we can turn up the tone of, or the volume of the vagus nerve, or turn it down. The vagus nerve is, let's see if it goes back over. No, okay, well, I lost that ability. Okay, the vagus nerve is primarily sensory. So you can see the lever there on the sensory one. We can bring sensory up, or we can bring sensory down. So in the stomach, you can have a sensation of butterflies, or a person says, oh, my heart is swelling with love, or my heart is broken, or we feel pitter patter of love in our heart. That's sensory. Also, it goes into the ear canal. And this I love, because we can do wonderful ear work. And you've seen other people talk about it. And here we can actually take the ear and give the ear a little bit of a pull up. And if you want more information on that, you can, I have a whole piece on that is free for people to see on the blog post on that one, and exactly how to work the ears to be able to stimulate it. But that's really important, because you think of babies and children with chronic ear infections. So it also goes into the eardrum, which captures my attention. It also goes into all of the viscera. So that is the sensory. Now, a little bit of it is motor, which is about the muscles of the pharynx and the soft palate and the larynx. So that is how we can do swallowing awareness through movement lessons. We can do Feldenkrais mouth lessons, where we have lessons that we count the teeth, and then we bring the tongue out, and we bring the tongue to be the thing around the roof of the mouth. And I want you to think, if you've done Feldenkrais lessons, think of all the movement lessons that can be done with the tongue and coordinating the tongue and the eyes together. Also, let's see. Also it is involved in sympathetic and parasympathetic. You see that all the way over to the side. Some people think the vagus nerve is a lot about sympathetic, but as the polyvagal theory has been proven, it's really about helping us to stimulate parasympathetic, but it's about creating the balance between the two. So vagal tone is about creating the ability to go from sympathetic to parasympathetic to a place in between, and the ability to recuperate. And that is part of the definition of the Feldenkrais method. So what can we do to help ourselves? My favorite thing, food. We've got things with bone broth for minerals. We've got fermented vegetables, kimchis. These are all the foods that you can go look up that will help you with digestion, that will create healthy gut bacteria. The nuts are filled with minerals that help to keep the sphincters closed. And well, we all know artichoke is just good for everybody all the time. And even though it's a surprise to look at cucumbers cause some people to belch, but if they don't cause you to belch, they actually are really good for acid reflux. So the best thing you can do is you do Feldenkrais movement to help with the acid reflux. Eat your dark leafy greens every day if you can, if you don't have a thyroid issue, and you know what you're eating that helps you. It'll help stimulate your amino acids to create alkalinity, to create sphincters to close, because they're getting the proper minerals so that these smooth muscle fibers can close on their own. And that's just with food and creating good, healthy gut bacteria in the gut, right? Because our health is about what to eat. Now, what not or where not to eat? Don't eat in Texas if you have acid reflux. There's so much hot, spicy peppers. If you have acid reflux, no tomatoes, no tomato sauce, and no chili peppers. So I'm laughing. My boys had lived in Austin, Texas. We used to go visit them, and we ate from one place to the next. So I love Texas. I love hot, spicy food. Thank goodness I don't really suffer too much from this. So, but there's things that we can do, but just have some common sense. So when it comes to vagal nerve, two very famous people said, "Here's looking at you, kid." And if you want a little more information, you can get, more of the stuff. This is my website. And let's see, do I have one more? Oh my gosh. Okay. Oh, whoops, sorry. Those are the ATM lessons. So I think we can stop sharing. Yep. Okay.
Yeah, that's wonderful. Very informative and helpful to us to get a good feel of the anatomy of what we're going to be playing with here in the movement lessons, I think, because we're doing these. I'm sure you're going to lead us on things that are external cues, but we're going to be connecting, I assume, with some of those internal places that you were showing us. And of course, we all can use help with better eating. So that you just barely touched the tip of the iceberg there for us, I know, on that.
Absolutely. And it makes a difference. And I think, a really big one is notice if you always have, even an hour after you eat, if you have a little tickle in here and you feel like you need to eat again. Yeah. And it's because you're sensing something, but it wasn't really necessary because you're hungry. There's a little acid coming up from the bottom of the stomach tickling.
Yes. Let me just make a little announcement here. We're going to get ready to go into movement. If you are willing to be on camera and release your rights to your image so Elinor has an interactive audience, please raise your hand. I will make your video live. So hopefully a few of you will be brave and raise your hands for us. And while I'm getting that together, Elinor, exactly how was it that you got inspired to connect the vagal nerve with this? Because you kind of started doing this a while ago, maybe before the whole gut thing was really big.
Well, the vagal nerve actually caught my attention when I was working with special needs children who have irretractable seizures. And these children were being hospitalized. These babies and children with severe cerebral palsy or brain injury were being hospitalized for weeks at a time with seizures, and they ran EEGs and they ran scans, they ran everything, and they could never find the focal point in the brain on there. And it happened to be one day, a mom was in my studio with me with her child, and I just happened to have my hand resting on his belly while we were doing some work, and I felt in my hand like that, and I went, So I pulled my hand away and I went, is that me? Maybe I got nerves. So I put my other hand. Oh, I felt it. I pulled my hand away. I didn't feel it. Put my hand back. I didn't feel, because I needed to check out to see if that was me. And within 5 minutes of me feeling this, the mom starts blowing in his face, going, Dylan, Dylan. And I looked up at her and I go, what are you doing? And she goes, he's starting to go into a seizure. His eyes are starting to blink and roll back. And I went, oh my God, I felt that in the belly. That's the vagus nerve, right? I mean, it's like, I studied a lot of anatomy and physiology in college, and I'm like, that's a big wandering nerve. That meant that was the vagus nerve. So I go, hold on a sec. Let me just see if we can do something. So I did some work on the belly with the intention of talking to the vagal nerve, and the seizure stopped.
Wow.
Stopped. And you want to know what, Cynthia? We filmed it. I taught mom how to do it. Mom went home and did it. And you want to know what? He never had another seizure again.
Wow.
He had been on 11 different medications. The neurologist took him down off of 9, kept him on 2 just in case. And he was never hospitalized again.
That's a wow moment.
That was a huge wow moment. So of course I delve into, let me know, even understand more the innervations of it. And it is deeply involved in our well-being, not just for our brain, but it is involved in our connection as human beings. It is involved in our ability to breathe and not stop breathing in the middle of the night.
Yes.
Right? Like babies, like children. And it is deeply involved in our digestion. I can't speak. Digestion. It in our stomach motility, right? Because so many people have gastric delay or delay emptying of the stomach. Mm-hmm. This can be worked with.
Yeah. Thank you.
So in Feldenkrais, if we teach them to incorporate that, to understand that in themselves in the movement, and we can do that with our hands in the functional integration part, we can help them. But in addition, I teach public how to do this for themselves. It's that teachable.
Great. That's fabulous. Okay, let's get a little taste of that. So I'm going to, we have 5 people who are willing to go on camera. So I'm going to start bringing you up. Give me just a moment here to do that. It'll be exciting for us to have a few people join us.
Oh, hi, everybody. Hi, Anna. Hi,
Beth. I don't have all their mics turned on.
Okay.
So that, yeah, thank you. Okay, so I just need to say that because you're now visible to Elinor, I need you to all understand that what we're about to do is not medically supervised. Even though Elinor can see you, you are responsible for moving within your own comfortable range and following any requirements that you have from your doctor to be, careful or have some kind of level of restriction that only you know about. So if you all agree to that, as well as agree to let us use your image here on video, could you just please raise your hand for me? Lindsay, I got a couple more. Beautiful. Thank you so much. Okay. Elinor, please teach us. Oh, I'll raise my hand too. Elinor, please teach us a few little handy things for all of us to use.
Okay. Well, I love teaching them in small doses so that it's not like a whole 45-minute piece like our typical awareness through movement lessons are. But is anybody here right now in this group feeling a little bit of a tickle that goes in the chest? Or do you feel at all often where you have tickle in the chest, like from acid reflux?
They could raise their hand.
And do any of you know people who suffer from acid reflux?
Mm-hmm.
Yeah? Okay. So what I like to do, very, very simple, is if we can start to follow with the pads of our fingers, to follow the digestive tract, starting from the mouth, and imagining, well, first we're going to start with following from the mouth, following the tract. But when you follow the tract, the digestive swallowing tube, you listen with your hands that you go in just a little bit of a turn, just a little bit of a turn, a little clockwise turn. When you follow it down the digestive tract. And be careful around the throat. Be very respectful. You're touching the weight of the skin of a grape. That's how thin and light. So as you sit comfortably and let your head be relaxed, and it's here. So you can see, do you see, for me, it's like a little bit of a turn that goes, and if you turn, can you feel that it creates something to stop that tickle, that funny little something that can happen in your throat, that softness in your face? And how far, let's see if I can do this, how far down your chest can you take this? And keep in mind, I know I move further away, so I'll try to speak louder. Keep in mind that you're still touching the weight of the skin of the grape, because we're talking to the enteric nervous system. The enteric nervous system is the nervous system of your organs. They are not surrounded by bone and tough stuff. That means it's sensitive, and the listening skills of your viscera, of your organs, is highly, highly attuned. So barely a touch is enough for that information to be received. If we go deep and we touch deeper, the nervous system will back off that feeds to those organs. And what you'll be working with is more the connective tissue part. And I'm wanting you to work with the vagus nerve and the motility here. So you find it and you create just a little tickle. I was thinking two things at one time. You feel that tickle can go away. So I last night started feeling a sore throat coming down with a cold, and my throat is bothering me. That's why you saw me cough at that one point or choke. But all I have to do is, even with that, it's not acid reflux, but it's kind of like a sore throat. And I can go in, and do you see, I go into that quarter of a circle, and it quiets that down in my throat, because that sore throat in that area will create an irritation to the vagus nerve. You ever notice if you have a sore throat, you also feel funny up here too, in the upper part of the face. So we can work the vagus nerve going all the way down, and then going down to the stomach. So the stomach is down at the bottom of the ribs, and for most of us, a tad over to the left. So it's down at the bottom, which is the xiphoid process, the bottom of the sternum, the bottom of the ribs, and just a tad over to the left. Now, the cool thing about organs is they are a little bit free floating, but not completely. So some people, the stomach can be really pulled over. It can be hanging a little bit. But for most of us in a good state of health, it's just here, whoop, slightly tilted over to the left. And so we can go around that stomach. We can go around the stomach. It's about the size of your fist, and create these little quarter circles. But Be gentle. Be gentle, because even though it's a thick, strong muscle, it's sensitive. And if you push hard on the stomach, it's an icky feeling. So we go gently and then come back here to the chest. Because what happens most of the time, that acid is coming from the stomach up and it creates an irritation here. So all we have to do is quiet it down in that quarter of a circle. And we can go back up to the throat. Notice the ease of your breathing. Breathing, yes. And then come back down. And let your hands, when you're ready, to rest in your lap. Now, if you felt a little bit of acid before, does it feel different now? You can feel a difference. Yeah. And you know, the cool thing is we can do this with animals too. So we had a beautiful large dog we adopted later in life, and she had severe irritable bowel disease and acid reflux. And so it's putting one hand on her chest and one hand up on the withers behind the shoulder blades and doing this same, following it down. And within moments, the reaction that she had which was this. I just stimulated my other dog. What? She would pop her lips and stick the tongue out like she was eating peanut butter, but she hadn't been. As soon as he did that, the stress in the eyes went away, the popping of the lips went away, the lip smacking and tongue smacking went away, and even the dog didn't have acid reflux. That is pretty cool. That's the gentleness of the work that we do, which is so brilliant and so amazing and so inclusive and gentle. It is for us to do for ourselves, and it is for us to do for others and for our animals. Now, let's say I had a really bugger-boo and I really had strong acid reflux. I might go the weight of a whole grape or two. Imagine 2 grapes in your hand. That's me being aggressive and pushy. I might give that. See, if you go the other way and notice, does it do anything for you? And then go the first way and notice if that feels like that closes it off, that it quiets it down. One way will quiet it down. One way either doesn't do anything or can create it to open. I think that has to do with the spiral direction of the DNA. And that's something that I talk about a lot in spinning, right? In the way the cells and things go in what direction. But for each person, you find which way works the best for you. So now, how did that work? Could you feel something? Mm-hmm. Yeah. Okay, good. And it's a whisper of a touch. And isn't that cool? That's the work we do.
It's very cool. Thank you.
And you can take 5 minutes to teach that to someone, mm-hmm. and to teach that to your clients and to do for yourself. So we eat our dark leafy greens and we don't eat a barbecue in Texas. No. And we do the hands-on.
Is this a little inspired by T-Touch from?
So T-Touch is Linda Tellington Jones created this beautiful body of work that is world renowned on circle and a quarter. And one day, we're doing circle and a quarter to outline limbs. I used it to help people who have suffered brain injury and they don't move the arm or don't move the part. And we would use the circle and a quarter to go all the way around and to remind the homunculus, the area of the brain, to remember the image of the body. And suddenly they can move, they get this, and then we can start to bring the arm and get functioning back by drawing the image back using those. And so when I did this, I go, you know, I showed it to Linda. I go, Linda, this draws me a quarter of a circle. I don't go a circle and a quarter. It's just a quarter of a circle. And she goes, yes, yes. And both of us threw out DNA, right? That's a spiral. And it's a spiral going in. And she doesn't commonly teach that, but it was like it happenstanced. It came about. I brought it up to her and she goes, yeah, that's this. So I didn't even know that. And I've been with her for, I don't know, 36 years, something like that. And I didn't even know that. So, and Anka Rechtenwald is down at the bottom. She is also a Feldenkrais practitioner and T-Touch practitioner and teacher and trainer and all of this in this work. And so she knows the same. We both have spent many years working with Linda with it. And you'll see, I'm going to do Linda's heart hug at the end because that is amazing for acid reflux.
And we have a question, Elinor. It is, how are you thinking of clockwise? Phoebe asked, how are you thinking of clockwise? As if the face of the clock is on your chest facing outwards?
So that is a really great question. I'm going to answer it like Linda would answer it, right? So I want you to find which way goes easier, right? So which way, and clockwise for me is as if the clock were on my chest and 12 o'clock is on the top, 6 o'clock is on the bottom. Hold on, let me do this. 3 o'clock is on my left and 9 o'clock is on my right. And clockwise is going that way. Mm-hmm. Now, I'm right-handed. So it would be interesting to see if someone was left-hand dominant. Is anyone in this group left-hand dominant? Ah, okay, Cynthia.
But I do go to the left. I still like going to the left.
Meaning?
The clock is towards, the 3 o'clock is towards my left shoulder.
Okay, so then we can start to talk about, again, there's that DNA spiral. There is that turn that goes clockwise.
Elinor, can you explain again the difference? Because I feel it's easier to go to my right rather than to my left. Mm-hmm. So what's the difference in how we experience what we're actually doing with clockwise versus counterclockwise?
You know, the truth is, I don't even have to say clockwise and counterclockwise. For most people, it tends to be clockwise. But like Linda would say, the same is go find the way that it fits for you. So the way that it fits for you is the most important. So let's go straight into the heart hug, because this will be, Lindy, this will be the perfect example. Okay. So as you're just sitting on the floor, sitting with your feet on the floor, and bring your hands to your chest. And this is Linda's beautiful, beautiful, beautiful heart-rendering heart hug. And this, I work with vagal tone and acid reflux and anxiety. So you take the skin, and it can be this way. I like to put both of my hands and the ball of my hand, the heel of my hand, excuse me, on my sternum. Or you can just open it. Or if some women are very large breasted, you can just use the soft back of your knuckles and go that way. Whichever way works the best for you. That's the nice thing. See, and that is like Feldenkrais and T-Touch, what works for you. And now you can go around the clock where 6 o'clock is down, 12 o'clock is up. Okay. And whatever is from one side to the other. And just go around the clock. And you make your way up a quarter of a circle and back down. So let's say 12 o'clock is up, 9 o'clock is down, 3 o'clock is to the left, and 9 o'clock is to the right. Okay, so I'm going to start at 6 o'clock, and I'm going to go all the way around the clock. So I start at 6, go all the way around the clock, back, touching all the numbers all the way down to 6, and then come back up to 3, and then curve it back down. And let's do this several times, using it each time to increase our level of awareness. And what we're doing, we're thinking Feldenkrais, so we're going to move, right? But let's think in terms of gliding the skin of the chest over the connective tissue. We're doing something completely different here. So we're staying with our body still, but we're gliding the skin over the connective tissue, over the bones. Can you feel the difference when you glide the tissue? And when you glide the tissue, you get a 2-for-1 here. You improve your vagal tone because you release oxytocin. Oxytocin is the hormone and neurotransmitter for health, healing, and happiness. There's beautiful books on it. If you want, I can get you the name of a beautiful book. At the moment, I don't remember. Anka may remember it. That is about oxytocin. But Linda's sister wrote a whole chapter in it, and so did we have another practitioner wrote a whole chapter that when you glide skin over connective tissue, that gentle touch is what produces oxytocin. And Feldenkrais is mostly often a gentle touch, soft touch. It's not about going in deep and creating pain and bruising. Now, maybe a practitioner wants to do something deep to work some connective tissue stuff, but here, this is different. We're gliding the tissue, and we start at 6, and we go around, and this time we breathe in through the nose as we go around the circle. And then exhale through very small pinhole of the lips. When we exhale in that small, slow pinhole of the lips, we're creating a little bit of a back pressure. And that back pressure goes down the bottom of the diaphragm to the stomach to close the sphincter. And I know, thank you. Yeah, right? I mean, Beth, it works. We could... And it closes the sphincter. All of a sudden, burn, baby, burn is gone, baby, gone. And here, we're now also producing oxytocin, that hormone and neurotransmitter for health, connecting, healing, and happiness. And that is our vagus nerve. And this you can do for yourself every day. I have taken so many pictures and video clips watching TV of somebody famous being asked a question and they answer like this. And I'm like, oh, I point to my husband, look, look, look. They're answering from the truest part of themselves. They're touching their heart. When they touch their heart, they're being honest and sincere. That's vagal tone. That's the bonding and connecting. Do you see how easy it is? We can go through the outside of our body and touch the inside of our body that increases our health, our digestion, our happiness. And then we add good movement into it with awareness through movement lessons. These look simple, Cynthia. Yeah. But I can assure you they are important, and they are things we can do for ourselves every day.
Elinor, Elizabeth would like you to clarify if it's 1 1/4 turn and then back a quarter.
Yes, starting at 6 o'clock, going around the clock, all the way back down to 6, and then up to 3 or 9, wherever your clock is, and then glide it back down and take a break for a moment. And do that again around the clock, passing all the numbers, passing 6 o'clock, gliding up to 3 or 9, and then gliding back down. And now, if you'd like, you can change that and go to other areas of your chest. So you don't have to stay in one place. Follow your instinct, follow your guide, what feels better. You can do a few here. I love right here. That's my favorite. But I can also change it around. Do you see?
Good. Thank you. So I'm going to take some of you off now. I'm going to leave Lindsay up to ask her question. Lindsay, if you'll hang around, we've got questions from 2 people that I think you'll want to take. So let me just get things reset up here. Thank you all for being brave and joining us for that. It's nice to have an audience.
And it's simple movements.
So, Lindsay, I don't know if you remember your question anymore, but would
Lindy,
you like to ask? Lindy, I'm sorry, Lindy.
That's okay. Hi, Elinor, it's great.
Hi, Lindy. Nice to see you.
My question is, when you went through all of the symptoms, how do you know whether the symptoms are related to acid reflux or to something else?
Well, here's the thing. All I want to do is open your mind to the possibility when you're seeing all these symptoms that it could be this. It could be so simple as, and what changes do you make? Food, nutrients. I'm curious, are they on proton pump inhibitors, acid reducers? Because if they are, my worry about acid reducers that come in proton pump inhibitors, the ones that are over the counter that are not nutrient oriented, actually block the acid production, and people end up with peripheral neuropathy because it's blocking B12 from being absorbed. And we want B12 for our brain to be clearer as we get older. And we need the B12 for nerve conduction in our periphery and hence our lower legs. So when a person is older, I'll ask them, how do you feel your legs, your lower legs? Because if I start to see that there's some peripheral neuropathy, I'm like looking at all of it. You know how in Feldenkrais, we'll watch someone walk. And a lot of people with the beginning of peripheral neuropathy will say, I don't have a problem with my legs. I feel just fine. But I'll watch them walk and they walk a little bit more flat foot. They don't have that suppleness in the foot in the gait. And then they may have a knee problem or a hip problem. So I'm looking in terms of that. So, but it's just opening up that possibility, because if we don't think of that as even a thought, and that was as simple as that, which by the way is the majority of people in North America. It just is. And that's part of the standard American diet, the white food, the simple food, you know, that in itself breeds the breeding ground for acid reflux. So when you think about if the majority of people have it, well, let me just open my mind to it. And it's easy to teach them these things and nutrients to take and food to eat and making a couple of lifestyle changes. Then we see change. We see that they're improving. We're like, oh, I guess that's what it was.
Right. Great. Lots of applications. Thank you.
Thank you.
Oh, thank you, Lindy. It's so good to see you.
Okay, we have 2 more questions. Do you have time for them? We're running over.
I always have time.
Okay, and then we'll finish up. So we're going to be going to Crystal. Let me find Crystal. Okay. Crystal, I think your
video is off.
Might not have your video on, but I'm going to try to allow you to talk. Can you click on your little microphone so we can hear your voice?
Hi, Crystal.
I don't have a working camera.
That's okay. You don't need a camera. Go ahead. Can you want to ask your question or tell us your story?
So I'm in my mid-30s, but my entire life I have had digestive issues. And from a young age, I had acid reflux, and I saw chiropractors and naturopaths, and I did the standard therapeutic interventions like diets and supplements and lifestyle changes. And about 3 years ago, I had a bout of really bad food poisoning, which I now understand has a lot to do with stomach acid problems. And I had hiatal hernias and all that other stuff before the food poisoning set in. So now I have something called small intestinal bacterial overgrowth. And part of the recovery from that is toning the vagus nerve, because there's the SIBO affects the tight junctions in the digestive tract. So those would be some of the sphincters actually that you pointed out. And I have a bit of neuropathy in the ileocecal valve. So it doesn't clear the bacterial overgrowth properly because the valve doesn't open and close correctly. And I'm wondering if there's a specific Feldenkrais exercise that would target that valve.
Listen, Crystal, remember how we just did that little quarter circle and I said, what if we went to the top of the stomach to close it?
Yes.
So right there is my ileocecal valve, right? So if I go a couple of inches below my belly button and a couple of inches over to the right is the ileocecal valve. The ileocecal valve is where the small intestines make the junction to the ascending colon. It becomes the beginning. That's a bugaboo for a lot of people anyway. So you're not alone in it. But if you just go there and you work on it, and when you're lying in bed at night and you very gently, literally the weight of the skin of the grape or 2 skins of grapes, nothing more than that, and you feel that little quarter of a turn, you might hear blip, blip, or like that, 2 little pops like that.
Yeah.
Right. So that's the liquid from the small intestine going into the large intestine and the valve shutting.
Right. I'm familiar with that because my chiropractor used to do an adjustment and that would happen. I would get that release, but it would never stay.
It's an educational piece for you. It's a neurological retraining like Feldenkrais is. Right.
Right.
So
yes.
If you tend to be walking, for instance, with the right hip hiked up and the psoas on the right side tighter.
Yeah.
Did I describe it?
Oh yeah. Right now, my hip is killing me, and I've been doing. I'm not a Feldenkrais practitioner. I'm just.
No worries.
Not on public, but I've been going to YouTube doing those videos.
So, good for you. Good for you. This is so doable that what happens is if my psoas muscle is so pulled up on the right side, it's going to affect my ileocecal. It can affect my ileocecal valve. And so, so when you do the Feldenkrais awareness through movements, do the lessons where you see them doing rocking the pelvis around the clock, and then taking the chest and going with the chest to go around the clock in all directions. And there's so many amazing lessons that connect the upper and the lower and all of the body to go together.
Right.
And all of a sudden you go, oh, wait a minute. I don't have pain in my right hip anymore because I'm sitting so balanced on both sides. Oh, that now makes room for the ileocecal valve to be able to function well.
Right. And I just wanted to go back to something you were talking about earlier that made a lot of sense to me. I've actually had vertigo for 3 years, and I had facial numbness on the right side, and I don't know how to explain it, but it was like light sensitivity and the feeling of my right eye being pulled back. Couldn't hear out of my right ear. It's just amazing. Actually, Cynthia, I've been doing a lot of your videos online, and thank you so much.
You're welcome.
You have no idea. It's making me emotional. It's given me a tool to positively identify with my body, and that's like life-changing.
Oh, that's wonderful for us all to hear that that's working for you. I would just like to say, Crystal, that, and for other people to know this as well, it's not any pressure, of course, but Elinor has an acid reflux webinar coming up. So we will be posting in the comments links to Elinor's site, but basically her site is onstickytopics.com. You can also find that if you get lost later and you think, what were those links people kept talking about? You just go to feldenkrais.summit.com, click on any particular speaker's name, and down in the bio section, it has the links to their page.
And
so,
actually, it's the course is online. It's a recorded 5-part or 6-part course that's online. So if you go to the website on stickytopics.com and go all the way over onto the right side of the screen, you'll see online courses, and just click that and it'll take you to it. And the 6-part, it is very reasonable. And it's from a course that I taught online that we recorded. And so, and it's really workable, and you'll get so many amazing tidbits. And a lot of movement lessons to incorporate with it.
Thank you so much, Crystal. And I hope that'll be really helpful to you.
It was. Thank you so much.
You're welcome. I'm going to ask the last 2 questions, Elinor, and then we're going to wrap up. So there was a comment that came from Beth Scott, who said she once saw Mark Reese. For the people who are wondering who that is, he's a Feldenkrais practitioner that has died, but beautiful, lovely soul. I once saw Mark Reese use a client's hand to trace their GI tract from mouth to near pubic bone with a very light touch. This seems likely to be what he was doing. It seems like what he was likely doing.
Wow, I didn't know that.
Yeah.
And Mark was so sensitive.
Mm-hmm.
His level of sensitivity, Beth, I'm so glad that you brought that up. I did not know that. And there you go. And out of his own need too, by the way.
Yeah. And Chris Stribling asked, would this be effective while lying down?
Oh, yes. It's so effective lying down. Okay, so every night before I go to bed, I lie in bed. Typical Feldenkrais practitioner. We bend the knees, we rock the pelvis, we roll the head side to side. We notice how, oh, now I'm balanced. The day of making me like this, I'm back like this. So tomorrow maybe I'll wake up like this, but at the end of the day, I'm right? So we work on ourselves. What I do, a little bit of that to bring myself back to normality, but I also do the tracing. So I trace it all the way, and it's going in that little quarter of a circle. That quarter of a circle for me is the listening. It's listening and doing at the same time. Then I go to the stomach. I listen all around the small intestines until I get to the ileocecal valve, and then I trace it up, the ascending, trace it across the transverse, trace it down the descending colon, and then across and down. Now, mind you, the descending colon, where the descending colon bends is usually another bugaboo. So the right side for a lot of people, like Crystal brought up, the ileocecal valve can get a little stuck. It's so easy to work it. Also on the left side, where the descending colon bends towards the midline, that also can get a little hardened. And that's where constipation is involved. Most of the time, right there. All we have to do as we lay in bed, just encourage it by that very gentle touch. And I promise you, the weight of a half a grape, that's all you need, because you're talking to the nervous system. Tomorrow morning, mwah, you will relieve yourself in ways that will make you so happy you couldn't have imagined. What a great way to start the day. Fresh and new.
Thank you.
And by the way, when we are backed up and constipated, the vagus nerve gets fritzed. Okay, because the vagus nerve is feeding to those intestines. So when those intestines are free flowing, the vagus nerve can pump and communicate, and then less likely for acid reflux. It comes right back to it.
Great. Thank you so much, Elinor. You're delightful and informative and warm and caring all at the same time. When it's very helpful. So thank you for joining us. We appreciate it very much. And this is going to conclude this session of the Feldenkrais Awareness Summit with Elinor Silverstein. Please remember we have streaming sessions at 8, 12:30, and 8 p.m. Eastern Standard or Eastern Daylight Time every day through the 8th. Today at 2 o'clock. It is not a live item, but on your live streaming page, you will find a link to the ATM, the Awareness Through Movement lesson that was recorded by 17 different practitioners in 17 different languages. So just in 30 minutes from now, you will have the option to hopefully find something close to your home-based language. And I know for some of you, the summit is very challenging because it's all in English, and I appreciate that. You know, maybe in a future iteration, we'll at least be able to do translations. YouTube is starting to come up quick on live translative possibilities. So who knows, in another year that could happen, and we might have more options for that. Also, tonight is going to be one of our large talks with Dr. Daniel Siegel, who is a four-time New York Times bestseller list guy, and has going to help us understand awareness and the mind, along with Donna Ray, who is a Feldenkrais practitioner
and trainer.
Really, really valuable talk, and we would love to have you come back for that at 8 o'clock and listen in.
Gonna be great. Wow. Cynthia, thank you for creating this possibility. Moshe is happy beyond belief. Moshe Feldenkrais. So this is his dream.
Good, good. Thank you so much, Elinor. And thank you all.